Okay, you know that moment. You wake up, feel your eyelid, and there it is, that annoying, sometimes painful little bump.
Ah, yes, the Stye, or Hordeolum, technically.
Exactly. We're doing a deep dive into styes today. Think of this as your super quick revision guide. We're pulling this straight from our Stye revision notes, aiming for clarity, you know?
Definitely. We'll cover the basics, what they are, what causes them, how you spot them, and importantly, how you deal with them. It's the essential breakdown.
Perfect. So let's start right there. What is a stye exactly?
Well, fundamentally, a Stye, or Hordeolum, it's a localized infection or inflammation right there on your eyelid. And there are really two main kinds to know about.
Okay, lay them out for us.
So first, you've got external styes. These happen at the base of the eyelashes and those glands. Easy way to remember, E for eyelash, E for external.
External eyelash, got it.
Then you have internal styes. These involve the meibomian glands, which are actually inside the eyelid structure. So think I for inside, I for internal.
Inside internal. Makes sense.
And those meibomian glands, they're the oily ones for tears, right?
Precisely. They produce the lipid layer of the tear film. So, yeah, quite important.
So what usually kicks off this infection then? What's the cause?
The main culprit is usually bacteria. Most commonly, it's Staphylococcus aureus, staph.
Right, Staph aureus, common bacteria.
Yeah. These bacteria get into the eyelid glands or maybe a hair follicle, and that leads to the infection and the inflammation you see and feel. It's often the same bacteria behind other skin issues.
Okay, and who's more likely to get one? Are there risk factors?
Yes, definitely. Poor eyelid hygiene is a big one. If you're not keeping the area clean, bacteria have more chance to, set up shop.
Right, like not washing hands, touching eyes.
Exactly. And using old or contaminated makeup or not cleaning contact lenses properly, that's another risk. Also, things like existing skin conditions, rosacea, for instance. Hormonal changes can play a role, too. And naturally, a weaker immune system makes you more susceptible.
Is there a mnemonic for that? There is. It's a bit rough, but helps. Think dirty hands, makeup mess, skin stress, hormone Hess, immune distress.
Okay, hormone Hess, I like it. So, pathologically speaking, what's going on under the skin?
So the bacteria cause an abscess, basically a little pocket of pus and inflammation right in those eyelid glands. For external styes, it's the sebaceous glands near the eyelashes.
Okay.
For the internal ones, it's deeper, affecting those meibomian glands within the eyelid itself.
Got it. Now, sometimes eyelid lumps aren't styes, right? What else could it be? The differentials?
Crucial point, yes. A chalazion in common, that's a blocked gland, but it's usually not infectious initially and often less painful than a stye, at least at first.
Okay. Pain is a key differentiator there.
Often, yes. Then there's perceptal cellulitis. It's more of a widespread infection of the eyelid tissue, more redness and swelling. And blepharitis, which is more chronic inflammation of the eyelid margins, plus other sort of less common eyelid infections or inflammations.
Right. So important to distinguish. How common are styes overall, like in the UK?
We don't have exact UK prevalence figures, but anecdotally and clinically, they're considered pretty common. They really can affect anyone, any age group.
Okay. And the classic signs, what would someone typically notice?
The textbook presentation is a painful red lump right on the eyelid margin or within the lid. You might see a little white or yellow head on it. That's the pus. And the area around it will likely be swollen, tender to touch, maybe just general eye discomfort, feeling like something's in the eye.
So if you suspect a stye, do you need tests, investigations?
Usually, no. Diagnosis is almost always clinical, just based on looking at it and hearing about your symptoms. Investigations aren't typically needed unless, it looks unusual, it's not clearing up, or someone gets them repeatedly. Then you might investigate further.
Okay, straightforward. Let's talk management. How do you deal with a stye?
The main thing, the first line, is warm compresses. Just a clean flannel soaked in warm water, held gently against the closed eyelid for, say, 5-10 minutes, several times a day.
The classic warm flannel trick.
It really helps. The warmth encourages the blockage to clear and the pus to drain. Think. Warmth helps the pus push. Also, good hygiene is key. Keep the eyelids clean. Maybe use specific eyelid wipes. Definitely avoid eye makeup and contact lenses until it's fully healed.
And antibiotics.
Sometimes. If it's quite severe or not improving, a doctor might prescribe topical antibiotic drops or ointment. For really persistent or large ones, especially in adults, Minor surgical drainage might be an option, done by a professional, of course.
Right. What's the usual outcome, the prognosis?
Generally, it's really good. Most styes resolve on their own or with those simple measures within, say, a week or two.
That's reassuring.
It is. But they can come back, especially if those risk factors aren't addressed, the hygiene, the makeup habits, etc.
Okay. And complications? Anything serious to worry about?
Thankfully, complications are rare,
Yeah.
very rare. But theoretically, the infection could spread to adjacent tissues. That's called preseptal cellulitis, which we mentioned as a differential. And sometimes, if the inflammation just sort of grumbles on without fully resolving, it can turn into a chalazion, that non-infectious lump.
Okay. So wrapping this up, the key takeaways for styes.
Well, remember, they're common eyelid gland infections, usually bacterial, often staph aureus. They're typically self-limiting. And simple things, especially warm compresses and good hygiene, are your first port of call for management.
Good summary. And perhaps a final thought for everyone listening, pay attention to that eyelid hygiene. It's simple but can make a difference. Also, just be aware that not every lump or bump on the eyelid is the same thing.
Well said.
And if you want to dive deeper into this or other topics for revision, definitely check out pastthemsra.com and freemsra.com for more resources.
Great resources there.
Absolutely. Thanks for joining us for this deep dive into styes. We'll catch you on the next one.